For years, there was virtually no way to treat elderly people suffering with severe aortic stenosis.
Their hearts weren't working, but because of their age, they were high risk and had few options. But all that's changed thanks to a less invasive procedure. CBS 21's Lara Greenberg explains in this week's Doc Talk.
Doctors say to beat aortic stenosis, you'll need a valve replacement. That used to be done through open heart surgery, but now they're using what's called the TAVR procedure with a cow or pig valve. It's the most common way to go and the safest for people of all ages.
The following segment is sponsored by Geisinger Holy Spirit.
Karen Daughtry needed her first valve replacement 9 years ago.
Open heart was a difficult experience. And then this summer I woke up and suddenly I couldn't breathe.
9 years and already she needed another replacement.
The valve had torn. No difficulty with the doctor or the surgery, it was the valve itself.
Karen suffers from aortic stenosis and more than 500,000 people across the U.S. are diagnosed with it every year.
The valve gets thickened, it gets all necrotic, and the valve, instead of opening, just stays like that.
Years ago, Dr. Dave says most doctors replaced the valve with a mechanical valve, but it wasn't a great option.
When we put mechanical valve in some patient, they get stuck on anticoagulation throughout their life because they have to keep their blood thin, otherwise the valve will clot off.
But now most doctors use valves like this, made from cows or pigs. It's what Karen Daughtry opted for when she needed her second replacement.
It's a very particular group of patients where this is an excellent option because you don't want to open up somebody's chest a second time because it's all scarred.
Aside from the makings of the valve, the procedure, known as the TAVR procedure, goes through the groin area instead of open heart surgery.
There's a little cut down in the groin, and hopefully no one sees that.
After this procedure, Karen says she was up and walking the next day. She says it's changed her whole life.
Within a 6-week period. And Dr. Dave did such a great job that for the first time in years, I'm back to work.
Doctors say these pig and cow valves can give patients another 7 to 10 years. With this week's Doc Talk, I'm Lara Greenberg, CBS 21 News.